Good afternoon, guys. This afternoon's topic A takes a look at dementia from the economic side. So, and the financial burden it causes families. Okay, so we're gonna go through that side of dementia today for discussion A. So please join me in discussion A. I'll be right with you. I got to set up for the show. Give me 2 seconds, guys. Gonna get my gear. Okay. The article highlights the often overlooked economic burden of dementia in the U.S., emphasizing that family and friends provide 224 billion worth of unpaid care annually, far exceeding the 53 billion spent on direct medical expenses like doctor visits and nursing homes. When unpaid caregiving is factored in, the total annual cost of dementia reaches 277 billion. Researchers also uncovered stark state by state discrepancies. For instance, West Virginia, despite having a relatively low cost of living, ranks among the most expensive state for dementia care due to the extensive unpaid caregiving hours required. In contrast, places like Washington D.C. report lower per person costs. Second sheet. The findings underscore how dementia disproportionately impacts economically vulnerable families and highlight the hidden social and financial toll on caregivers. If you're interested, we could explore how this compares with projected trends or brainstorm policy approaches to ease the burden on unpaid caregivers. Would you like to dig deeper? The long-term financial effects of dementia on families are profound and often underestimated. Here is a breakdown of the key impacts. Okay, erosion of net worth. Families of people with dementia experience a dynamic decline in financial assets. On average, more than 60% of their net worth is lost within 8 years of diagnosis. Raising out of pocket costs, health related expenses more than doubled for families managing dementia, including cost of medications, home modifications, and paid in-home care that often not full not that's often not fully covered by Medicare. Increased reliance on unpaid caregiving. By the second year after symptom onset, people with dementia require 3 times more care hours from family and friends than their peers without dementia. This often leads to loss loss income for caregivers who reduce work hours or leave jobs entirely. Okay. High rates of institutionalization. Dementia patients are nearly 5 times more likely to enter nursing homes within. Hold on, not get it. The first 2 years, especially if family support is limited. These facilities can be financially draining. Greater Medicaid enrollment. As financial resources dwindle, families often turn to Medicaid enrollment uh, in this safety net program nearly doubles for dementia patients over 8 years compared to peers without dementia. These effects ripple beyond bank accounts. They reshape family dynamics, strain emotional reserves, and can even influence integrational wealth. Integrational wealth. If you'd like, we could explore policy solutions or financial planning strategies that help better these long-term costs. Would that be helpful? There are several policy solutions, both federal and state levels, designed to ease the burden on families. Affected by dementia. Here are some of the most helpful or impactful national level initiatives. The National Plan to Address Alzheimer's Disease. This comprehensive federal strategy, updated annually, aims to prevent and treat dementia, improve care quality, and expand support For families, it includes goals like enhancing public awareness and promoting healthy aging. Credit for Credit for Caring Act. Proposed federal tax credit that would provide financial relief to family caregivers by offsetting some of the costs associated with unpaid care. Medicaid, home and community based services, HCBS. These waivers allow states to fund in home care, respite services, and adult day programs, helping families avoid costly institutionalization. State level strategies, state dementia plans. Many states have developed tailored plans that include caregiver education, respite care funding, and improved access to local services. Paid family leave policies. Some states offer job protected paid leave for caregivers, reducing the financial strain of taking time off of work. Elder abuse protections. States are strengthening laws to protect people with. Give me a second, guys. Dementia from financial exploitation and neglect, including mandatory training for adult protective services and law enforcement. Emerging ideas, caregiver navigation services, programs that help families understand and access available resources, often through case manager or digital platforms. Public private partnerships, collaborations between governments and nonprofits to expand dementia friendly communities and supports networks. Okay, if you'd like, we could explore how these policies are playing out in Pennsylvania or brainstorm ways to advocate for stronger caregiver protections. Want to go local with this? Um, Absolutely. The national plan to address Alzheimer's uh, expenses is is used in the U.S. government's comprehensive strategies to tackle Alzheimer's and related dementias. ARD or ADRD first launched in 2012 under the National Alzheimer's Protection Act or NAPA. It's updated annually and guided by an expert advocacy council. The 2024 update outlines 6 core goals. 1. Prevent and effectively treat ADRD. Um, this includes accelerating research, identifying early biomarkers, and translating findings into clinical practice. Okay, 3. Enhance care quality and effectiveness. Strategies focus on building a skilled workforce, ensuring timely diagnosis, and improving care transitions across settings. For expand supports for people with ADRD and their families. This means culturally sensitive education, caregiver support, future care planning, and safeguarding digital dignity and rights. Okay, 5. Enhance public awareness and engagement through national campaigns and partnerships with state, tribal, and local governments. The plan aims to reduce stigma and promote dementia friendly communities. 6. Improve data to track progress. Federal agencies are working to better monitor outcomes and evaluate the effectiveness of interventions. Promotes healthy aging and reduce risk factors. The newer goal emphasizes lifestyle interventions and public health strategies to delay or prevent dementia onset. The plan also supports initiatives like the Alzheimer's Disease Programs Initiative, which funds state and tribal grants, and the National Alzheimer's and Dementia Resource Center, offering over 300 free tools for caregivers and professionals. Would you like, if you'd like, we could explore how Pennsylvania is aligning with this national strategy, or delve into how these goals intersect with your interest in precision medicine and caregiving support. Want to zoom in? Uh, Great question. The national plan to address Alzheimer's disease and precision medicine are increasingly intertwined, especially as the field shifts toward more individualized approaches to prevention and diagnosis and treatment. Here's how it here's how they connect. Goal alignment. The first goal of national plan to prevent and effectively treat Alzheimer's by 2025 directly supports precision medicine and by prioritizing early detection through biomarkers and genetic profiling, tailored interventions based on individual risk factors and disease subtypes. Okay. Transition of research into clinical practice, a hallmark of precision medicine. NIH Alzheimer's Research submits. These summits tried to these summits tied to national plan have especially focused on building a precision medicine research enterprise. The 2024 summit emphasized deconstructing disease hereditary using multi multi-omics, neuroimaging, and wearable data. Identifying molecular subtypes of Alzheimer's to guide targeted therapies. Okay. AMPAD 2.0, Accelerating Medicine Partnership, Alzheimer's disease. The public-private initiative, aligned with the national plan, uses single-cell profiling, computational modeling, and diverse population data to discover new biomarkers, define disease subtypes, develop stage-specific and population-specific treatments. Broader implications. The the synergy is reshaping how we think about dementia not as a single disease, but it's a but as a spectrum of conditions with distinct biological signatures that open the door to precision, precision diagnostics, blood based biomarkers. Personalized care plans. Hold on. Personalized care plans, ethical frameworks for equitable access to emerging therapies. If you'd like, we could explore how this intersects with your interest in adaptive DBS, uh, or how Pennsylvania dementia strategy is incorporating precision tools. Want to zoom in on one of those? Absolutely. There are some standout precision medicine initiatives that are already transforming care across conditions. Here are here are here are a few that align especially well with your interest in dementia, neurodegeneration, and personalized care. A one all of us research program, NIH. The ambiguous U.S. initiative is collecting health data from over 1 million people to understand how genetics, environment, and lifestyle affect health. It's already fueling discoveries in Alzheimer's risk prediction, pharmacological economics, and chronic disease management. 2. AMP AD 2.0 Accelerating Medicines Partnership Alzheimer's Disease, a public private collaboration using multi omics, machine learning, and single cell profiling to identify molecular subtypes of Alzheimer's. It's helping researchers develop stage specific treatments and uncover resilience factors in diverse populations. 3. Gene site psychotrophic tests. Okay, that's A for you. I'll be back on shortly with B. Give me a little bit for B, please.